This book ought to be required reading for every physician, every healthcare provider, and every person that's dealing in legislating healthcare. Because until we deal with this problem, we can never fix what's going on in healthcare in this country. It will never be fixed until we deal with the social determinants of healthcare cost.
My father was very inquisitive. He was an investigator. And ultimately, as the dean of the Medical College of Wisconsin, was part of a team really involved with trying to solve problems of healthcare, the rising costs of healthcare delivery in Milwaukee.
Looked at the data that Dartmouth had produced about Milwaukee. He lived there, he grew up there, and said, gee, why would we be more expensive? And when he started digging into it, he found out that the amount of poverty there was different, and the spending, where the differences were in zip codes with poverty, not in the zip codes with wealth.
But what he wanted to do is uncover something that was being ignored, because it was a very big thing, a thing that affects us all. The myth that healthcare problems can be solved, healthcare delivery problems can be solved by addressing waste and inefficiency.
As he began to focus more and more, it became evident that the root cause was poverty, and that is what this book is dedicated to illustrating.
I think the reason poverty has never been discussed is I think it's become the third rail of politics. It's one of the most difficult issues to deal with. It's expanding, and it is driving costs in all sorts of areas.
We think of healthcare as, I go to the doctor, I go to the hospital, I go to the clinic. We don't think about the patient goes home. They may not have a home to go home to. They may not have enough money to buy the food. They don't have a car. They may not be able to afford a taxi to come back for an outpatient visit.
It's very clear from my practice and from our work at the Foundation and Buzz's work that those are the real drivers and determinants of healthcare spending. The sickest patients, the patients that needed the most care, that cost the most money to treat, were the ones who were the most impoverished, the least educated, had the most social issues to deal with.
The message that I hope the readers will really take to heart and take home with them is the need to take action now, to really begin to address these needs that Buzz Cooper points out so well in his book, that if we don't pay attention to them, we're leaving them behind as a burden for future generations. And we need to do it because it's the right thing to do. This is America. We've got to take care of all of our people.